So, hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder, and today I'm going to explain the topic tenotomy. Sorry for the late video, guys, and thank you for the support and patience. So, without wasting time, let's get started our topic tenotomy. Okay, so what the basically tenotomy is, what this terms mean. If we divide this word, that is teno plus otomy. Otomy means cutting and teno means tendon. And what is tendon? As we previously discussed, tendon is an cartilaginous structure, fibrous tissue that connects the muscle to the bone. Okay, so we can say that a tenotomy is a surgical procedure to cutting or releasing a tendon. Okay, so that to reduce the abnormal deformity. So, why the tenotomy is performed? So, the tenotomy is performed to release the tight or the contracted tendon, to correct the deformity, to improve the range of motion of the anatomical area which get affected, to reduce the pain or the muscle imbalance. Okay, so here is toe contracture, curl toe, claw toe, club toe, hammer toe deformity, painful pressure point corns, tendon imbalance, diabetic toe ulcer caused by the toe pressure. So to ask the question that the for the hammer toe deformity already the hammer toe correction is performed, then why tenotomy is performing? Because what hammer toe deformity is? So the hammertoe deformity to correct the correction of the it is a complete treatment to correction of the bent toe deformity. Okay, which includes the tenotomy also, which includes the additional procedures like the arthrodesis, fixing of the K-wire fixation. Okay, and some arthroplasty also. So tenotomy is just an part only in part of the hematocorrection. So here only the tenotomy isolated procedure will study that. For the isolated tenotomy also for the hematodeformity also the tenotomy is performed. Okay. So moving to the next, here we'll see the type of the tenotomy. So what is the type? Here is an two types showing. That is flexor tenotomy and the extensor tenotomy. So what is flexor tenotomy? Flexor tenotomy, it means the tenotomy that is a cut or release of the flexor tendon, and the extensor tenotomy to tenotomy which is performed on the extensor tendon. For example, here you can see that in the hand area, the flexor tendon in the front part of the hand, that is a flexor tendon present here, and in the back side of the hand, the extensor tendon is present here. Okay. So simple. Flexor tenotomy, the tenotomy which is performed on the flexor tendon, and the tenotomy which is performed in the extensor tendon. Simple. Coming to next. So what will physician actually do in the tenotomy procedure? We'll see that. So first of all, he will examine the toe, check the deformity, which type of deformity is there, whether it is curled toe, clubbed toe, claw toe, and then determine whether the deformity is flexible or the rigid. After that, he will identify that which type of tendon is there, whether it is flexor tendon, whether it is extensor tendon. Flexor tendon here, pulling the toe downward, and extensor tendon pulling the toe upward. As here we see the toe deformity topic. So we'll study the pulling the toe down, we'll see the toe only. Okay. So after that he will give the anesthesia, and after that the patient is usually awake. Okay. So next, in the tenotomy, that is there will be two approaches, percutaneous approach and the open approach. Okay. So during the flexible tenotomy percutaneous approach, what will physician do? The main key point is to using a small blade or a needle to make a tiny puncture in the anatomical area where it is uh, happen. Okay, and after that he will release or cut the flexor tendon, and the after that the deformity get improved. Now, during the open tenotomy, physician will make some, what is a key point? Make an large incision, make an formal incision to expose the tendon directly. So after that, he will cut or lengthen the tendon and close the incision with suture, and done when the deformity is more complex, additional repair needed. We'll see in the navigation and OP report how it is navigated and how it is done. Okay, so percutaneous, just learn that small incision, small blade or needle has been used, make a tiny puncture. Okay, and in the open tenotomy, there will be a large incision or expose the tendon directly. Moving to the next, ICD and the CPT codes. Okay, so in the ICD, there will be a medical diagnosis that is based on the whatever the condition is given. Okay, so Hammertoe, for the Hammertoe ICD will be M20 series, Clawtoe M25 into 1 series, and the contracture of the toe M24 series, diabetic toe ulcer code that is E11621 and ulcer code L97 series. So diabetes code based on the type of diabetes, that is type 1 diabetes or type 2 diabetes. Okay, and also L97 series. So based on the medical necessity is very much important. Whatever the given, we have to mention that. After that, the CPT code 280 series, 28010, 28232, 28234. So here tenotomy. As the CPT code only just define that, what is the difference? Okay, so tenotomy percutaneous to single tendon, tenotomy open extensor tendon, foot, tenotomy open flexor tendon. So what is the difference in these three code? First, the approach is different. Okay, percutaneous approach, open approach. Second one, that is which type of tendon is present, whether it is extensor or the flexor, and the third one, that is an anatomical location, and the how many tendon will be present, single, multiple. Okay, so coming to next, we'll see the coding criteria. Already we have discussed which type of tendon we have to see first, flexor versus extensor. After that, the approach we have to see that whether it is open approach or percutaneous approach. And the third one, that is an toe. Which toe is involved, great toe, second toe, or the multiple toe. The fourth one, that is an reason for the procedure, that is medical necessity. Okay, the hammer toe, clubbed toe, ulcer contracture, what were the diagnosis? Okay, we'll see that. And the fifth one, that is very much important, whether the tenotomy is an isolated performing or it is a part of laser surgery, larger surgery. Okay, for example, we already discussed that hammertoe correction. Okay, in the hammertoe correction, the tenotomy already involved. Okay, in the tenotomy already involved, and hammertoe, and some in the hammertoe correction there is some extra additional procedure like arthrodesis, K-wire fixation, arthroplasty. So these procedure has been involved in the hammertoe correction. So if the larger surgery involve the tenotomy, then why will code the tenotomy? No need to code the tenotomy with the larger surgery because it is already included in the larger surgery. So we have to check whether it is performed isolated or part of larger surgery. If it is performing isolated, then we'll code the tenotomy procedures. Okay. Next, key point we already discussed that if documentation say hematocorrection performed with flexor tenotomy, then the coder must define is tenotomy included in the primary hemato repair or it is separately reportable. We'll check this. Many times tendon release is considered as a part of hemato correction depending upon the technique and documentation. We have to code that. So already we discussed that point. So we'll see one OP report for the tenotomy topic. So here preoperative diagnosis, that is hemato deformity second toe right foot. Postoperative diagnosis same. Procedure performed percutaneous flexor tenotomy second toe right foot. Many coder what do after seeing that the pre and the pre-operative and the procedure, simply he will code that, but he will not see the procedure. So what the main thing is that we have to see the description of the procedure. So what so next procedure will study that the patient was placed in supine position, the right foot was prepped and wrapped in sterile fashion. Local anesthesia was administered to the second toe using an 18 blade. A small percutaneous incision was made at the plantar aspect of the right toe, and the flexor tendon was identified and released. Improved the alignment of the toe was noted after the release of the tendon, and the area was dressed and with sterile dressing, and the patient tolerated the procedure well without complication. So here the main key point will be there. First, location. So location is right second toe. The second key point, which type of approach? That is open or percutaneous. So here small percutaneous incision has been performed. The third, which type of tendon is there? Flexor tendon is there. And what is done? Release has been done. So here you can say that the diagnosis is hammertoe deformity. Then why hammertoe correction not performed in the procedure? And anyone can see here? No, no any additional procedure has been performed. K-wire fixation, no. Arthroplasty, arthrodesis, no. No any additional procedure has been performed. So by looking that only the release has been done, only the flexor tendon get released. So this procedure is only percutaneous flexor tenotomy as it is written here. So you'll see the navigation of this procedure. Okay. So first, hammertoe deformity. Add the diagnosis. Okay. Hammertoe. The specified right side is there. No procedure. M24-1. Okay. What is the procedure? Tenotomy. So we'll give the term tenotomy. Tendon sheath incision? No. There is other unspecified. Which type of location is there? Which location? Foot and toe. Which exact toe? Whether it is percutaneous or open? Percutaneous. Talking about the single toe or the multiple toe? Only the single toe. We'll add the modifier. Based on the incidence, we have to see also that RT or LT or T modifier, toe modifier, we have to, and the toe modifier second digit, right? Okay, 28010 T6, and ICD is M24-1. So this one is the procedure. What if there will be a percutaneous not open procedure, and which code will give? So here in the CPT, we see that 28010 for the tenotomy, single tendon and percutaneous, and 28011 for the multiple tendon, percutaneous. But in the parenthetical note, what we see that what is written for the open tenotomy, see the 28230 to 28234. Okay. So tenotomy open, tendon flexor, foot single or multiple, toe single tendon, separate procedure. So this procedure. Okay. So that's it for the today, guys. We'll see the next topic, TNEX and the topaz procedure in the next video. So please like and subscribe my channel. Thank you, guys.